Local and federal officials say the fight against fentanyl is proving to be as deadly as the murder rates. Over the weekend, 3 people died of suspected fentanyl overdoses in St. Tammany Parish in a 24-hour span. Just a few days ago, we learned 2 NOPD officers had to receive Narcan because of exposure to fentanyl while responding to calls on the job. They're both okay. And this morning, we are joined by our medical correspondent, Dr. Hebert, to talk about the dangers of this drug and a possible vaccine to fight against it. That would be huge.
Yeah, I am really fighting to try to get this information out today because we're on the beginning of Mardi Gras. And right now, what happens, we all know what's happening on the Mardi Gras route, right? People give you something to drink or somebody gives you some drugs that you're not supposed to take. The amount of fentanyl that can kill you or the exposure to that, not even taking it, can really be dangerous, folks. I want you to really pay attention. I mean,
it doesn't take a lot to kill you.
1/10 the weight of a grain of rice.
Oh, wow.
Can kill you, right? 73,000 people died from fentanyl overdoses in 8 months in late 2022. 73,000. And so the issue is that people aren't really taking fentanyl like, oh, I want to relax from it or I want to sedate myself from this. They're not doing that. They're getting hoodwinked thinking that they're buying some weed or something or they're drinking some alcohol and it's in there or you know, they're taking a pill. So that's why you got to be very, very careful. Now, there is a vaccine that we're coming out with because some people do get addicted to fentanyl because you were using other things like Percocet and MS Contin, so they get addicted to fentanyl. So what this vaccine is going to do is basically block that receptor so that you don't feel high. So it's being developed by the University of Houston and makes antibodies to prevent that fentanyl from getting into the brain. And it prevents the fentanyl from suppressing the respiratory center so you don't get high, so you don't take it. So that's a really good thing. It's not ready yet, but we're there. We're getting close to it.
Would that be, if you've taken the vaccine and then you take what you think is a Percocet from someone and it's got fentanyl in it, that'll save you?
It'll save you.
Okay.
And that's very important because people don't know. They just don't know.
Yeah, and we're seeing high school kids thinking they're just getting a Ritalin or something and they're dying.
And that's why I say, don't just buy drugs from someone because that person that you're buying drugs from is a criminal.
Yep.
Remember that. They're not trying to make your high good. They're trying to make money, and by any means necessary. It's not for you. Trust me on this one, folks. This is bad.
All right, we've been reporting on that eye drop recall that's killed a person and left some people blind.
Yes, now this is about, this is artificial tears, right, by Ezra Care, and it's a lubricant eye drop. Delsum also makes artificial tears, and it's lubricant eye drop. Basically what has happened here, they were not taking the appropriate tests, right, to do this. So they're contaminated with Pseudomonas aeruginosa, which is a bacteria that is very drug resistant. So you get some blurry vision, some photophobia, some redness, and 55 people have had some really bad outcomes with this, and one person has died, right? So if you have this, if you bought it between May 2022 and January 2023, please make sure you go to the FDA website, fda.gov, and you can find out which lot numbers. But if you take any of these things right now, just stop. Just stop, because it can really cause you to have some really bad problems, okay?
All right, February is Heart Month. Let's talk about the early signs of heart disease and symptoms of a heart attack.
Yes. Okay, so I want you guys to remember, this is really important, okay? If you feel like you're having a heart attack, all right, chew an aspirin. All right, I actually keep one aspirin with me, and I keep it like in a baggie. Okay, because you and it's already chewed, right? I didn't actually chew it.
But don't take the aspirin from someone else.
Yes, exactly. Just crush the aspirin because you can actually get the aspirin into your bloodstream quicker, 5 minutes as opposed to 8 minutes if you swallow it. Okay, so the symptoms of heart disease, we're going to say nausea, vomiting, chest discomfort, long-lasting cough, irregular heartbeat, stomach pain, all these things, pain in the arm and the back and the neck and the jaw. Okay, but women, very specifically, women, if you have an inability to sleep, a lot of gastroesophageal reflux, okay? Pain in your shoulder. Those are things that women have that men don't have to say that they're having a heart attack. We could talk about cancer all day, but the #1 cause of death in America is heart disease, women and men. So what we have to do is stop eating horrible food, decrease the fat in your food, okay? And then lose some weight. please lose some weight, and then you will decrease your risk of heart attack.
Okay, we're out of time, but the heart disease, is that something you live with for a while or that kills you real quick?
A heart attack will kill you real quick.
Okay.
But heart disease causes a lot of problems over long periods of time. So heart disease leads to heart attack. We're going to work on this month. We'll
Okay.
be back next week to talk about a little bit more in depth.
All right, let's get back over to Peyton. And Dr. Hebert does visit us every Tuesday on the Eyewitness Morning News. If you missed previous updates, you can get his expert opinion on our app, YouTube page, and website,